And I assure you, there's no decision that you take when you are angry that you will not regret. I promise you, go and check it.
My name is Wale Amino, and I'm the lead clinical psychologist at PSN Africa, that's Postpartum Support Network Africa. We're here at Ifako Jai General Hospital, and I just concluded a training with the nurses on emotional intelligence. Okay, so I'm glad that we've been doing this at PSN Africa because from the feedback we've been able to get today, it's positive, and the nurses are very much happy about the training. From what they've been able to share with us, we know that with this training, they would become better with the way they interact with the mothers at the antenatal clinics and even at the postnatal clinics. Basically, what the training entails is just to equip the nurses with soft skill in emotional intelligence, how to be able to emotionally be available for these mothers, to be able to identify through social awareness some of these mothers who are already presenting symptoms of depression. These nurses that we've trained today, they're not the first. We've been training nurses in other general hospitals, and we hope to keep doing this in order to provide sustainability for these women at the antenatal clinics in accessing quality care. Now, aside accessing quality care, we're also training the nurses on postnatal depression, on how to screen for symptoms of postnatal depression and refer these mothers appropriately. But this was what we've also done here today, and we'll also be doing in other hospitals where we go there.
Training on postpartum depression. So this is my second time I'm having it. I've had the first one at Timoshi, and I'm so glad that we're having it for the nurses here because why? Lots and lots of our nurses, the attitude to their patients and to themselves is appalling. But with this training, they should be able to know their limitations, how I need to behave or talk to my patient, and how I need to read the expression of my patient without the patient means telling us or saying anything from her mouth. Because our outlook will tell us with this patient, she's in serious need, she needs something, I need to come to her aid. I mean, with this training, is a plus, and it will be carried out to the letter, and it will give nurses much more attitude and disposition in the care and support of being the advocate for the nurse, and you should be able to defend them through the attitude, the outlook, and tell them, okay, this patient needs this, and not until when I said, nurse, I needed your assistance. Anywhere it is, let everybody know that there is something called emotional intelligence, how you can work out, how you can work on yourself, the society, and the community at large.
Hello, good morning. My name is Mary, and this is Postpartum Support Network Africa. Well, we are here live at Ifo General Hospital today, and we had our postpartum depression awareness with the mothers yesterday. We also had our emotional training with the nurses today.
There's no difference between you pushing and having your baby and you doing CS. You know this definition that we say, if you push, you are a Hebrew woman. Who just said that? Thank you. If you push, don't let anybody see you. Anybody that carries a pregnancy from day one until that very day, either CS or you are already a Hebrew woman. But it is not easy for you to even carry pregnant, let alone give back to your baby. So I would say don't get it twisted.
We have been taught about what postpartum depression is, postpartum blues, the symptoms, the causes, a lot of things that causes is like unsupportive spouse, body shaming, traumatic experiences that women go through, and all of that. Then we also have the symptoms like mood swing in women, isolating ourselves from others, and a lot of other things. There's nothing wrong in having any problem and speaking out about it. So it's good to, any problem we have, we should always come out to say anything we feel. Anybody that body shames or anyone, you have a right to express yourself. Because at the end of the day, you die and die, you'll be alone in the grave. So we need to speak about this thing and let the whole world know that depression, postpartum depression is actually real. And there's no harm in burning with CS. for the fact that you can't even get pregnant, you are already a Hebrew woman. Meanwhile, there's nothing particular about being a Hebrew woman that gives birth by herself. So the most important thing is the mother and the child is fine. So PSN Africa is a good thing. They should put it more in antenatal classes. It's a very good thing.
We've visited over 10 hospitals in Lagos State and 6 here in Ogun State. Today we are at Sangota State Hospital. I'm able to educate over 70 mothers about postpartum depression, which most of them are very, very new to.
You go see say some people that go just jump inside water, you no go know wetin dey cause am. See, if you say make we look am, na a lot of things dey happen. If you see some people, if they just born finish, they no dey happy. We no know why they no dey happy. If you see some of them, they don rape them. Some of them, they don abuse them well. So when they come finally marry, they will come look am like this. They go just look like their life don dey messed up. So na the thing wey we learn about today, how we fit take overcome am. Now, for us to overcome depression, person wey see say e dey depressed, you go call am, you go counsel am. After you don counsel am, you go try to introduce some medication wey you go dey take. Then you go try do follow up. After that follow up, you go dey check am every time, because na this thing we learn. Because we don see some people after wey dem born, dem no go allow their husband touch them again. As if that thing wey dey for their husband, this thing, e don become snake, e go bite them. Some people, dem go just look the pikin, hate the pikin for no reason. Some people, you go see them, dem go just go kill their pikin. So all these things, person wey see say e get this kind of thing, you go call them, you go advise. And some people na hereditary. You go see say some people, dem go just born finish, dem go run mad. No be say that somebody dey do them, no be say spiritual case. Maybe that thing dey inside their forefather or inside their generation. So anybody wey get this kind thing, we go call them, we go advise them, we go counsel them, we go give them medication. Then we go do follow up. No be say when we don counsel them, we go leave them like that. We go do follow up for that person. So me today, I don learn a lot. And here wey we dey na Obasanjo General Hospital for Ota. Na im we dey, so we don learn a lot. So my friend, if you see anybody wey dey depressed, make you try call that person, advise am from wetin you don hear today.
The goal is to ensure sustainability for what we do at PSN Africa, and I'm very much positive about the fact that what we have done so far has yielded positive results, and moving on, we can only get better. For you who are watching us right now, I'd also encourage you to join us at PSN Africa. You can volunteer with us by reaching out to us through our social medias and our website at www.postpartumafrica.org. Thank you very much.